Hello, everybody. My name is Dr. John Mason, and in my day job, I'm a gastroenterologist. So I work at Trafford Hospital in Manchester, and I got into doing gastric balloons originally because I'm an endoscopist, and that was back in 2006. So since then, I think I've done around 1,500 gastric balloons of various different types. So I've got quite extensive experience of doing gastric balloons. And I'm here to talk to you today on behalf of Allure Weightloss, and I work with Allure Weightloss placing gastric balloons in Manchester. There are also centres in London and Birmingham. So I'm going to kick off by just going through some background about gastric balloons and about the Allure Elipse balloon. Then I'm going to pass over to Kirsty Chewter, who's the dietitian, and she's going to explain to you about some aspects of the diet. Then we're going to move on to Raj Jain. Now, Raj works for Allure Weightloss, is a patient coordinator, but he's actually got a balloon in himself at the moment, which I placed, and he wants to tell you about the patient aspects of it. So to start the ball rolling, that's just a quick bio of me. I think I've already said most of what is on that slide. So I've had an interest in weight loss and been doing gastric balloons for the last 15 years. And as far as I know, I've probably done as many or more gastric balloons than anybody else in the UK, certainly up there in the top few anyway. But we're not really particularly counting about that. I want to talk about obesity. So obesity obviously is a spectrum. And this will start with somebody who is just a few pounds heavier than they'd like to be. And at that end of the scale, it is almost a cosmetic issue. Somebody wants to lose weight for a wedding or something. But as people get heavier, it starts to become a more significant health issue. And these are just some of the complications that can happen from being overweight. Now, partly it depends on how much weight you're actually carrying, and partly it depends on whereabouts in your body your weight gets stored. By the way, if there is anybody there who has got any questions, or if they've got any anything they want to ask, please feel free to interrupt. There's the chat and the messages are on at the side. And if you want to ask any questions, you can put them either in chat or in questions. I don't think anybody's asked anything yet, but there's no such thing as a silly question. So please do ask, and we try to keep it fairly informal. So I say weight loss or weight gain and the health risks, they're all included on this slide. And basically the bigger patients get, the more serious the health risks become. So health loss is a major issue with people being overweight. It stops being a cosmetic issue, it becomes a health issue. And the more heavier you get, the more likely you are to get some of these problems. Obviously, you start off with the traditional weight loss options that people have. So people will go to the gym, or people get referred to hospital and get followed up. They can try diet apps or diet plans and all sorts of weight loss supplements. But overall, 76% of patients are not happy with the traditional options that they've got. So if you can't lose the amount of weight and maintain the weight loss that you'd be looking for with one of these, people would then look to a procedure, a medical procedure, to help them lose weight. And you can start off with gastric balloons. There's different choices of gastric balloon, or you can move on to surgical options. So certainly a few years ago, the big thing was the gastric bands. They're not as popular now as they used to be. Now there's moved on to gastric sleeves and gastric bypass as surgical options. And it can get quite confusing, the number of options that we get. Generally, you go for the less invasive options for patients who are at the lower end of the obesity scale, and bigger patients traditionally would be considered for a surgical option rather than for a non-invasive option. But everything is available. So I want to talk to you about balloons and about the Allure weight loss program in particular. So this is using the Allurion Elipse balloon, which is a balloon that you swallow and is in place for 4 months and will then pass spontaneously. I've got a question from Deborah asking why gastric bands are not so popular now. Possibly would be better directed to a surgeon than to a gastroenterologist. So this is obviously a surgical option. I think the problem with gastric bands it's a strength and a weakness. This is the same with lots of medical options. Gastric bands require maintenance to get a good result from them. So with what surgeons in particular would like to do is to do an operation and walk away. Once the patient's left hospital after their operation, they need some dietetic follow-up, but they don't need any more procedures. With a gastric band, to get the right result with a gastric band, they can need topping up or reducing in size repeatedly over a period of many years. And to get the best results from gastric bands, they need long-term follow-up. So I think that's part of the reason why they're not so popular now, to answer that question. Have I ever used the balloon, or would I? I haven't used a balloon because I don't think I'm quite big enough to qualify for one. Yes, if I was big enough and I needed to lose the weight, I would definitely consider a balloon. I've got a comment from Isabel Cooper. I don't need surgery, I don't think. Want to lose 2 stone before my wedding. Can I use Elipse? And your BMI is 29. So yes, you are overweight enough to qualify to have an Elipse balloon. And if you want to lose 2 stone for your wedding, you're probably an ideal patient too. So I have put some balloons in very large patients. I think the biggest patient I've ever put a balloon in had a BMI of 60 odd. So yes, it can be for patients who don't want to have surgery. Is it okay to use a balloon with a hiatus hernia? The short answer is it depends how big the hernia is. So a small hiatus hernia wouldn't be a problem. A big hiatus hernia is a contraindication to having any sort of balloon. I am 18 stone and I'm 5'5". Could I have a balloon? Absolutely. Yes, that's no problem. So I'll go on to the slides. Do keep asking questions if as you like, but I just try and whip through some of them. So how do balloons work? It takes about 20 minutes to have an Elipse balloon, and an Elipse balloon, when we start off, the Elipse balloon is wrapped into a capsule, and it's about the size of a locket throat sweet. That's how I describe it to my patients, which the patient is going to have to swallow. And it has what looks like a bit of string attached to the sweet, and the string has got markings on it which tell us how far in it's gone. The string is actually a very fine tube, and that's what we use for filling the balloon. I've got another question about 80 kilograms and 150 centimeters, and I would have to calculate your BMI off the top of my head with that. But yes, Carisha, yes, I think you would be suitable to have a balloon. And Maxine, is there an age limit? No. Tricia, yes, you would be. A balloon would be an option for you. The capsule, the balloon is in a capsule about the size of a sweet, and you have to swallow it. So we give you a drink, and we pop the sweet into your mouth, and you have a big drink and swallow, and it goes down into your gullet. Some patients find it a little bit difficult to swallow, and if necessary, I can give a little push down the tube to help it on its way. Faustina, yes, I think you would be a good candidate for a balloon. As far as the price is concerned, I try not to get involved with anything on the financial side of it, because I'm, as a doctor, I try markings on the string, and when it's at 30 centimeters, we'll take an X-ray to confirm the balloon is in your stomach. Chelsea, yes, you would qualify. X-ray confirms the balloon is in the stomach, and we then connect it up to a bag under pressure that squeezes 550 mils of fluid into the balloon. And then we pull the string off after another X-ray, and you go home. So you go home with 550 mils in your stomach. I've spoken to patients while they're having balloons put in, and one lady, after 2 minutes of pumping it up, said she felt like she'd eaten a pizza. After 3 minutes, she felt like she'd eaten 2 pizzas. And by the time the balloon was full, she said she felt like the Vicar of Dibley after eating 3 Christmas dinners. So the balloon makes you feel full. And when you go home, you will feel full sooner when you start eating, which reduces your portions, that reduces your calorie intake, and helps you to lose weight. So the balloon is there making you feel full, and it can help reduce cravings. and food hangs around in your stomach for longer, so you feel fuller for longer and you snack less. Yes, I'm getting questions still coming through. Does it make you look bloated? No, not usually, although you will feel bloated at the start. But actually, the size of 550 mils in somebody's tummy is very small, and it doesn't really make your tummy look any bigger. I've got a question. If you eat the wrong food, even though it's limited, yes, you can eat the wrong foods. And obviously, there isn't much room in your stomach with a balloon there. But, you know, halfway through, you could get a deep fried Mars bar down if you wanted to. That's always what I use as the most unhealthy food I can think of. And yes, if you eat high calorie foods, it is possible to limit your weight loss. I always tell people we get an average weight loss of around 2 stone, which I'll come on to in a second. But we do get some people who, for some strange reason, try to prevent the balloon working and will try and eat unusual things. And there is a risk of very disappointing weight loss. If you have to be sensible with the balloon in place, and you're going to get dietetic follow-up. So Kirsty will explain to you about good foods and bad foods and what the best things that you should be eating on and avoiding. How does it get placed? I've just talked about this, so I won't go through this. I've got my slides mixed up a little bit. So that's you swallowing the capsule. The second one is a picture of the x-ray with the balloon in place in your stomach. And the third one is what happens, how does the balloon get out of your body? So the balloon spontaneously opens. It's got a window in it that's held together by a stitch. And the stitch will burst after 16 weeks. And the balloon completely deflates all in one go. And all that's left is a very fine piece of plastic, which passes down through your intestine and will end up going down the toilet. How much weight do you expect to lose? Well, after about 16 weeks, we expect an average weight loss of around 2 stone. So we're saying it's 10 to 15 kilos or around 15% of your total body weight, which is quite a lot. So we've already talked about different size patients and how much weight loss people need to get. There's a lot of people who we've had somebody asking about, can we lose weight for a wedding as a short-term option? Absolutely. We've got a lot of people who've had a one-off event because we've been locked down for a year and people have gained weight from being inactive, and they need to do a one-off intervention. And a balloon's absolutely fine for that. It will help. If you put on a couple of stone in lockdown, it will help you get that off. If you are wanting to get married and you want to lose a couple of stone, it will help you with that. But actually, for people who've been overweight for a longer time, a balloon is still a very good option because a temporary balloon doesn't mean that the weight loss is necessarily temporary. So this slide is about a paper that was published at IFSO, which is an international obesity conference last year. And with 12-month follow-up of people who'd had an Elipse balloon, they maintained, this is over 500 patients. Do you find it helps though with binge eating? It can help with binge eating, but there are issues with binge eating because if you binge eat with a balloon in your stomach, it can cause medical issues. So yes, it can be used for people with binge eating, but people with binge eating need careful psychological support. Ellipse balloons are very safe. There isn't any medical procedure anywhere that is completely risk-free. And largely these side effects that are reported with the balloons are reported with every sort of balloon that there is. The Allure Weight Loss program, we've got expert support. So certainly for patients, for the patients, I'm available to patients when I put balloons in. We also have regular dietetic follow-up, which Kirsty will be telling you all about. We have availability of a psychologist for patients who need that. And certainly if you want to maintain the weight loss after the balloon comes out, getting your head straight and getting psychological support can be really important in terms of not just losing the weight in the first place, but in terms of keeping it off.
Your balloon placement, and that is just while the balloon's settling in. So it's literally going from a liquid diet back up to solids, and that takes about a week to get to that stage normally. What you'll also get is the scales, and I really like the scales because they don't just show you your weight, they also give you a breakdown of your body composition. So for example, if you've decided you're going to, you know, start a gym program and start lifting weights and things, you might build some muscle, but you might also lose some fat, and it might not show on the scales, and people get really disheartened if they're weighing themselves and the number on the scale doesn't move. But you can see then, have you gained more muscle mass and lost fat, and that can be really motivating. What I also ask my patients to do is to send me their weight on a weekly basis. So the scales are set up to an app on your phone, and it's a very simple procedure where you would just ping it over to me, basically. So even though my input face-to-face consultations were over Zoom are 6 in total, I actually talk to you via email on a weekly basis, just to make sure that everything's okay. We also have a really good app that we use, that you have a 12-month subscription for, included in the package, and that helps you to track your food intake. And again, it's really easy for you to send me your food diary on that app. So again, that really helps me see exactly what's going on. So the second session is about a week after you have your balloon placed, after you've finished the texture modified diet. We then check in and see how you're getting on. We then sort of talk about, you know, have you got any problems? You know, we talk about the food app, and again, I remind you to sort of, you know, send your weights in on a weekly basis. So my sessions, like I say, we have 6 sessions, and actually, I think some people get quite anxious about the fact that the balloon is, once the balloon goes, you know, what happens then? And actually, how we set up the sessions is so that purposely, so that once the balloon has gone, you still have contact with me, and I think that can just, you know, give you that kind of feeling of safety. So that's pretty much all from me. I'm going to pass you over now to Raj, who's our patient coordinator, and he has an Elipse balloon at the moment.
Thanks, Kirsty. Thanks, John. So as John and Kirsty were saying, basically I'm the patient coordinator with Allure Weightloss. I'm 48 years old, and I've always struggled with my weight. Done various diets, like a lot of people I speak to on the phone. Been there, done that, tried that, put the weight back on. So when I was diagnosed with diabetes a couple of years ago, that really did change it for me. So, you know, I knew I had to get in control of my weight. You know, everyone has their reasons for losing weight, whether it's medical, whether it's health, whether it's cosmetic. My main reason was my health. So I did the procedure with Dr. Mason in Manchester, and you know, one of the main reasons, again with the diabetes, I want to see if I can reduce my sugar levels, and ultimately my long-term aim is to go into remission from diabetes, which would be brilliant. So that's my aim. Pictures. First picture, BMI 30. I'm 2 months in, and I thought it'd be funny to wear the same clothes, because from my experience so far, clothes is such a big indicator and a motivator in your progress. So I'm happy to say I haven't really worn that shirt since this photo, second photo, and I just feel great. And a lot of my clothes that I did have are looser. So that's my motivations, that's the progress so far. The next slide really is discussing my journey. So it is all about everyone's journeys, and the placements, as John said, it's a 20 minutes in and out procedure. At that picture there, you can see he's actually filling the balloon, so I'm starting to feel this feeling of fullness already. While the balloon is being filled, that lasts about 6 minutes. I think once the procedure's gone, the after feelings, the first night, there's absolutely nothing to deny. It's not nice at all. You will struggle. It's just the body's way of reacting to this new foreign object in your body. So, you know, we do get anti-emetic medication to help help soften that. But there's no doubt about it. The first night is tough. Day 2 is better. Day 3 is much better. So there is light at the end of the tunnel. So it is important to be prepared for a rough few days. I think that's something that a lot of people need to consider as well, and be prepared for that. Second shot there really is a side profile. Again, wearing the same clothes, and again I'll go on about clothes again, because I think I wouldn't believe if anyone in this room hasn't got clothes that they've kept, that they used to fit into and they've kept because they hope they will fit into at some point. I'm absolutely guilty of that. So I've got clothes that I said, yeah, I'll fit into those, never do. And the feeling of being able to fit into those clothes now, they're even loose on me, that is such a big motivation, and it keeps you going. You do have to work at the balloon, there's no doubt about it. You've got to work with how it's working. It can be a bit confusing at first. So if you look at the graph, I don't know if you can see it clearly, but I had the balloon in December the 4th. There's a significant weight loss in the first week, but then it absolutely plateaus for a week. And I can tell you what that is. That's number one, the body in shock, okay, and it's trying to hold on to weight that you've suddenly lost. But number two, it's because you're messed up in your head. You're thinking, hold on, I'm not feeling full, but usually I'm feeling full at this stage, or how can this small amount of food make me feel full? So it does take you about a good week after you've recovered to get back into understanding what's going on. And I think that's kind of why you do plateau. And then after you've got through that and you understand how the balloon does work, you really are on a downwards curve. Basically, you're losing the weight regularly. You send in your weekly readings into Kirsty. So yeah, no, it's 8.3 kilo, 8.5 kilos actually. That was I just adjusted the slide this morning because I weighed myself. It was 8.3 yesterday. And I feel great. I feel different. And I can't wait to see the end result. I'm expecting to lose another 4 kilos in the next 2 months. It does start to plateau in month 3. So that's my journey really in terms of the. So the next steps would be really is, if you are interested, to give us a call. I'm sure at some point you'll be talking to me on the phone. We'll then go through some questions, discuss a lot more detail about the Elipse. Then we'd say, if you'd like to go to an assessment call with our bariatric nurse, Debbie, who's also part of the program, so she'll discuss in more detail your medical history, your weight history, your family history, etc. And Debbie also provides you support for your first 3 days and during the program, so she'll be calling you up in the first 3 days when it's a bit rough. Then we book you in for a consultation via Zoom with your surgeon closest to you, the doctor. And then we book you in your placement date, and the journey begins. So that's pretty much the end of the presentation. If there's any more questions, what I'd like to is hand back to John to wrap it up and perhaps take some more questions. Okay. So I'll hand it back to you.
Yeah, thanks, Raj. There's quite a few questions online, and actually we might need Kirsty and Raj for these as well. So I think Isabel, there's a couple of questions for Isabel. One was about asking whether she can get extra dietetic support from Kirsty after the balloon's gone. I think Kirsty's already mentioned that she does provide support. We plan to give you support after the balloon is gone, but I don't know whether you're on about extra support outside that program.
So I think after, you've got my support for 6 months, while you've got the balloon in it, and after the balloon has gone. So I think it would be unlikely that you really need any more after that. However, that's not to say that I wouldn't be able to offer some more support if that was needed. We could sort of see about that further down the line, but I honestly don't think we need it. And can you drink alcohol? Yes, of course, you can drink alcohol. I wouldn't recommend it in the first week while the balloon is settling in. But alcohol tends to be full of empty calories, so it's like everything though. The point of the balloon and providing support is to try and get you to having a healthy, balanced lifestyle and diet. So it's about finding what works for you, that you can keep the weight off, the weight that you've lost, and you can still enjoy your life. You know, we're not expecting you to eat a perfect diet, not at all. It's just about moderation, really.
Yeah, I mean, alcohol doesn't do any harm in terms of as the balloon is concerned, but as Kirsty said, it's empty calories. You've got to remember there's so much calorific value in alcohol, you can run a car on it. So it's not a sensible diet food, but people have got lives to live, and hopefully when lockdown's over and people start enjoying things again, there's going to be some socialising and things. So poor people can drink, but don't overdo it. I think it's moderation in everything. Mark, you're asking questions about what support is available for people if they're ill, and I think that's probably one that's better directed to Raj, as he's the patient coordinator.
Yeah, no, absolutely. So if you're ill, throughout the whole duration of the balloon, you've got the bariatric nurse, Debbie, you'll have her number, you've got the support from the office. So you can contact us anytime, and we expect you to contact us anytime if you're not feeling good. We need to know so we can then deal with the situation. So the support is 100% there. In terms of, I'll go back on the alcohol question actually, because I did used to like having my Friday night drink, and with the weight loss I've had so far, I'm human. I would like to have a Friday night drink, but as Kirsty and both John said, it's in moderation. I'll do maybe a bit more exercise to burn a few more calories on a Friday morning, just so I know I can have an extra glass of wine. So definitely, we're not going to encourage it, but we're all human, and if you can incorporate it into a healthy lifestyle, a healthier lifestyle, or actually a more being more mindful about what you're taking in terms of your calorific intake, then yeah, absolutely fine. Exercise safely, again, I saw a question there. I think, what exercise have I been doing? I started doing the old Joe Wicks in front of the television exercises. I don't like doing gym workouts at all. I prefer to play squash, but I can't play squash. So I do those exercises 4 times a week, first thing in the morning. I need to. And again, that's done wonders for me as a person in general. It affects everything in terms of your mood, your mindset. So yeah, I recommend exercise definitely. That's how much I'm doing. Hernia, John, I'll refer that back to you.
Right. Okay. So the hiatus hernia, that's a difficult one, because there is usually we'd have a size cutoff. So the size cutoff for hiatus hernia would be whether it's 5 centimeters. If it's bigger than 5 centimeters, this is how much of your stomach is in your chest, and there would be a risk of the balloon basically getting stuck in your chest. And a big hiatus hernia that's big enough to do that is a contraindication to any balloon. If you've got an official diagnosis of a hiatus hernia, that would probably have been done at an endoscopy, and the endoscopist should have put an indication about how big the hiatus hernia was. If there isn't any indication, then really you may need another endoscopy to find out. So if we've got an unknown sized hiatus hernia, I'd be very reluctant to put a patient in a balloon in a patient if they've got a hiatus hernia and we don't know how big it is. Second thing is about surgeries, locations. Well, I'm in Manchester. We've got other locations in Birmingham and in London. So there should be somewhere near-ish to most people. And I suppose if you live at one of the top corners, you're quite a long way from any of them. But three locations at the moment. Would you say this helps to balance hormones and change your way of eating and relationship to food? Yes, absolutely. To balance hormones, very interesting in patients who have problems such as polycystic ovaries. There is a clear evidence of hormonal changes with weight loss, associated with weight loss. And certainly there was some data published several years ago in Australia that was suggesting polycystic ovaries is associated with reduced fertility and problems with fertility. And there was some data in Australia suggesting that weight loss procedures were as effective at helping people conceive as IVF is. So yes, it definitely changes your hormones. What does it change in your way of relationship to food? It teaches you how to eat a healthy portion and how to control portions. If you have underlying psychological issues with food, if you comfort eat and things like that, I can't emphasize too strongly, psychological support is available as part of the problem. And if you want to keep the weight off long term and you've got issues with your relationship with food, I would strongly advise you to get psychological advice as well as dietetic advice. Next question, a medical one. Being diagnosed with a leaky heart valve, could I qualify for a balloon? Yes, absolutely. Candy, is any food restricted in terms of things that might damage the balloon? Not unless you fancy eating broken glass or anything. I don't know. Not in a short word. No, things aren't going to damage the balloon that easily. They're not that fragile. I wouldn't advise you to. I always quote an example of how to damage a balloon by swallowing a fish bone, but I don't think anybody's going to deliberately go swallowing a fish bone anyway. So no, nothing that you would intentionally eat is likely to damage the balloon, unless you are one of those peculiar people who likes eating light bulbs or aeroplanes or really strange things like that. Yes, there are things that could damage the balloon, but not things that would normally consider as part of your diet. Teresa, I enjoy running. Can you still run? Yes, absolutely. The only exercise that I've advised somebody not to do with the balloon in was kickboxing, in case. But to be honest, if you were going to get a kick hard enough to damage the balloon, it would probably damage a lot more than the balloon. So yeah, probably kickboxing is not a great idea. But anything else exercise-wise, I think is fine. Candy, I don't know what you're not planning on, Candy. Not planning on kickboxing. Lizzie, I drink a lot of water daily. Will that still be possible? Yes, it will. We wouldn't advise you to drink a lot of water, particularly at the beginning, because people are quite sickly at the beginning and your stomach is much fuller. Candy wasn't planning on eating glass. I'm very glad to hear it. Your stomach will be fuller than it's used to, and you will be feeling sick. And if you overdo it with the water, you'll make yourself vomit. So at the very beginning, we actually suggest quite a restricted amount of water over the first 24 to 48 hours, but then escalating quite quickly to a pretty normal but low portion diet over the space of a week. And going on from there, can you drink? How much is a lot of water? I'm not quite sure how much. An average person wouldn't normally drink more than a litre or a litre and a half of fluid in a day. I mean, if you're drinking 5 litres, that's getting to the point where it's not a healthy amount of water, but I don't know how much, 3 litres a day? Yeah, you could probably manage that. Certainly not at the start. We would normally want you to stick to a litre a day at the very beginning, but as time goes by, you could almost certainly manage 3 litres a day. Anything, Kirsty, you think about diet water intake?
Just that before you have the balloon plate, you make sure that you are plenty of fluids, so that the first few days that you may be struggling with getting fluids in, you're not feel too dehydrated. But we give you lots of advice around that anyway. When you get a consultation, there's quite I don't know what the word is, but like a strict diet, I suppose, to stick to in terms of the textures and what you should be having. So for the first week, so yeah, you get plenty of advice around that. But you can certainly drink, plenty of water after you've everything's settled down. Yeah, I'd probably have between 2.5 litres a day would be about what I would normally advise people. Yeah.
If you're drinking to stop yourself feeling hungry, you won't need to do that with a balloon in, because the balloon can do it for you. If you drink water to stop you feeling hungry, that water stays in your stomach for a very, very short time. But my special 550 mils of water that I put into your stomach with a balloon will stay there for 4 months and it'll make you feel full. So that's a much better way than drinking to help you lose weight. Andrew Coe, who shouldn't have a balloon? Well, I don't know. There are medical contraindications to having a balloon. So I've already mentioned a hiatus hernia, that's come up. Patients with certain medical conditions, inflammatory bowel disease, Crohn's disease or ulcerative colitis, they can't have a balloon. People who've had previous surgery on their stomach can't have a balloon. I've already mentioned about, there can be major side effects. Do we have anyone who speaks other languages than English? Raj, I'll point that one to you.
We don't have people ourselves in the office that speak any other language apart from English. However, we do have translation services available to all our patients. I tell you, I'll go back to Teresa's question about can you still run after the balloon, because I do get that quite a lot from patients asking about exercise. You don't feel the balloon after 10 days for sure. It starts to subside after about a week. I don't even know I've got it in me right now. So yeah, you can certainly carry on with any exercises or jogging, etc. It's perfectly fine.
Yeah, Lizzie, MS is not a contraindication to having a balloon. You can have that. The problem with gastric surgery is if people have had gastric surgery, then it actually leaves a weakness in their stomach where the stitches have been, and there's a risk of the stomach perforating. So that's gastric surgery, as in surgery on your stomach as an internal organ. If you've had operations on your intestines, where the intestines have been cut and rejoined, then that's the reason you can't have a balloon, because there would be a risk once the balloon is deflated and it's passing through your system, there's a place where it could get stuck. So we wouldn't recommend that. Is the fullness uncomfortable? A myomectomy for fibroids, absolutely not a problem for the balloon. That's from Sidhu. Candy, is the fullness uncomfortable if Uber? I think the fullness is uncomfortable at the start. I think it becomes less of a discomfort as time goes by. So I think as Raj was saying, he's the patient who's had it. He's saying after 10 days, he's not particularly aware of it there until you start eating and eat less.
Yeah, I just to butt in there. After the first 3 days of the cramping, you just get general tightness sitting around the diaphragm and a bit of bloatiness. And that clears up literally completely, I would say. For me, it took about day 10 to start exercising. But the tightness around the diaphragm, the bloating, and you can just still notice that there is something there. 6, 7, 8 days.
Right. Candy, I understand now. Hit send by accident. Yeah, I think, yes, as Raj is answering your question, yes, you may feel as though you're uncomfortably full if you haven't eaten, but it doesn't last very long. And I mean, I've had a few classic phone calls from patients. So we do get a couple of phone calls. So people will ring very early and say, I feel terrible, take it out. And we'll say no, because it is going to get better all on its own. And I have had somebody 2 weeks in with a balloon phone me up and say, oh, Dr. Mason, I can't eat enough to keep a bird alive. And if any of my patients ring me up and tell me that, I'll tell them to celebrate, because that's actually the feeling of losing weight. And if it is, it certainly, if there is a discomfort, it will be for a short time and it will go away. You won't call it a discomfort for long. Right. Evie, 6 foot tall, 105 kilos. What's a BBL? Want to get back to 93. You only eat once a day, large portions, don't snack. What's a BBL? Can anybody help me out? Oh, okay. Yeah, no, you can. Yes. Yeah, that's no reason not to have a balloon. Yeah. So yes, absolutely, liposuction isn't a problem. Yes, you would be a good candidate for a balloon. It will reduce the amount that you can eat at your one large sitting of a day. Yeah. I
could actually relate to that question in terms of your liposuction. it's like John said, it's not a contraindication. With liposuction, you do find that you could put on weight in other places. So definitely having the balloon done is absolutely fine.
Yeah. How much time do you need off work? Most of the balloons we tend to do on a Friday evening because that gives people the full weekend. And I guess if you've had a balloon on a Friday evening, depending on what job you do, I would on average say people have got a 50-50 chance of being fit to go to work on Monday. Certainly if you've got a desk job, you'd be much more likely to be able to go on Monday. If you've got a physical job, the Monday after having a balloon done on a Friday might be a bit of a push. So I think time off work, if you a long weekend would usually be enough for most people.
I can add just to my experience again. I needed 3 days. Okay, lots of marketing is just 2 days. You're back to normal. From the experience that we've got as well, and this is by no means sexist, but women tend to do a lot better than men in the first few days. And another stat is that ladies that have had children do remarkably much better. I've heard comparisons to being 8 months pregnant. So I would definitely say, like John says, you do need time to recover. First 48 hours specifically, but then, everyone is different, but absolutely, John, I agree with you on that.
Yeah, working as a barrister, I mean, I'm sure you have different days at work, some of which where you will be more with clients, some days when you'd be in court. And obviously I certainly wouldn't have thought of having a balloon put in 2 or 3 days before you were due to be in court. I mean, if you have other days that are more office-based and paperwork-based, then you might be able to get away with going in and doing that sort of stuff at less than 100%. But to be on the safe side, I'd give it a week if you were saying about actually client-facing things or going to court. I think my best bet. Deborah, play the long game. Yeah, that's I don't quite know what you mean by that. Ivy, how is the balloon taken out? Right, so the balloon comes out itself. So I think, as I mentioned, there is essentially a cross cut in the balloon, and that cross is held together by a stitch. And the stitch is open to the water that's inside the balloon. And at approximately 16 weeks, give or take a week, and it is usually give or take a week, no more, no less, that stitch is going to burst, and that cross will suddenly become a wide open gaping hole in the balloon, and all the fluid will come out in one go. The vast majority of the balloons will pass down your intestine at that point and end up being passed down the toilet and donated to your local water company. A very small number of them, if the balloon happens to be in the top part of your stomach when it bursts, a very small number of them might unfortunately come out upwards and be vomited out. And that's not pleasant for patients, but it isn't associated with any medical adverse events. Deborah, yeah, that's a good point, thinking about the end result. That's the long game about thinking of something strange inside you. Yes, Chelsea, payment plans, I don't know. Raj, I don't know. The finance a slide about that, didn't you?
Yeah, we do. Basically, we can discuss this when you call in about the different various options with regards to finance for the balloons. Enrico, going down to your question, how much should I eat today? I can tell you exactly. Just give me a second, I can tell you exactly. So, because we give our patients this app, and it's brilliant because you put in your calorie intake. So today, so far, I've only eaten 800 calories. It's been a hectic day. Do I feel hungry? I feel a bit weak now, just because I do know I need something to eat. If I was still at the same level of my sugar levels of diabetes, I probably would have fainted by now. That's 100% certain. So I don't know if that helps. In terms of costs, I can put this slide back up where the costs are. No, 800 calories is certainly not normal. My calorie intake is 1500, and that's what I'm limiting myself to at the moment while I've got the balloon in. And once the balloon is passed, I'm looking at going up to about 2,000. But just today, it's because, yeah, I really haven't eaten that well today at all. So I am a little bit hungry, but yeah, starting to fade.
Okay. Any more questions? Well, it's been fun, folks. Thank you all very much. Thanks for coming. Thanks for sticking to the end. Thanks for your questions. You've made us all scratch our heads at least a little bit, which is good. I think we can call it a day now. Thank you very much.